Welcome to Wellness Health Services Health Talks. I'm Dr. Nderitu, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to look at gout and what your doctor needs you to know before it strikes. So imagine waking up with your big toe on fire. That's how gout begins. So the pain usually wakes you at 3 a.m. and this makes you think that possibly your toe has been broken, and the pain is so bad that you cannot ignore it. You wake up confused, scared, and then that is your first gout attack. So what is gout? This is a form of arthritis that is caused by uric acid crystals build up. These crystals are like tiny glass shards inside your joints, and this triggers an inflammatory process which causes joint swelling, causes restriction in movement of the joint, and causes swelling of the joint affected, and also intense pain from the joint. So who is at risk of getting gout? One, people with the high uric acid, people who have hypertension, and also people with kidney disease. So it is also people who have high consumption of alcohol, people who take amounts of high sugary foods, and also high intake of the red meat frequently and in big amounts. Then there is also the genetic predisposition. There is a genetic aspect in the metabolism of the purines, and that is genetic predisposition of some individuals to get gout. And then there are some medication like the hydrochlorothiazide. If taken in big doses, then they can cause an increase in uric acid, and this causes the individual to have attacks of gout. So when you are taking some of these drugs, then you need to know that you could be at risk of getting gout. So the uric acid is the real enemy in this disease, and usually the uric acid builds quietly and over time, and this is just a ticking time bomb, and it will explode at any time without warning. So one of the biggest ways to find out whether you are at risk of getting gout is if you have any of the risks that we have talked about, is to have your uric acid levels measured. So what are some of the common myths that people have about gout? One, only old men get gout. The truth is anybody can get gout regardless of their age. Then another myth, gout is not a serious problem. This is a serious disease that can completely affect your functioning and can also lead you to getting complications, especially kidney failure. Then there's a myth that if you avoid red meat, then you have no problem of getting gout. And I've seen some of my patients, when I tell them that they have gout, their uric acid is high, and then they feel bad because they think thinking that they either take alcohol or they are taking a lot of red meat. So some of the ways to prevent yourself from getting gout include: one, adequate hydration. Taking 2 to 3 liters of water on a daily basis helps you to pass most of the uric acid and flush out your kidneys, and this will prevent you from accumulation of gout stones. Then avoiding high purine foods like we have talked, red meat, organ meat, and then avoiding excess intake of alcohol, avoiding highly sugary foods, and also losing weight. This will help you be able to manage the metabolism of uric acid, and then of course managing hypertension and diabetes, which are risk factors for getting gout. And if the drug that you are using for the control of your diabetes, not for your hypertension, like the hydrochlorothiazide, then you should have your uric acid levels monitored on a regular basis so that you don't get surprises at the middle of the night. So, what is the role of your health care provider in the management of gout? One, they provide regular checkups so that your health provider will give you tips on whether you are at risk, and they also assist you to have the uric acid test done, and also help you with the interpretation of the test. Then will also help you in medication, especially when you have an acute attack. Um, your healthcare provider will provide you with a drug that will help you to relieve the acute attack and also help you in the chronic management of the gout. Remember that gout is a chronic disease if not well managed, and can even cause joint deformities, can lead you to have kidney failure, and can lead to other complications. Then lifestyle coaching as a key prevention method. Remember, as we have said, this is largely a lifestyle disease which is affected by the food that you take, your level of water intake, your level of exercise, how your weight is, and how you manage to manage these properly. So when to worry and when to act if you are concerned about gout. Well, if you have hot, red, swollen joints, see your doctor immediately. This will help you to relieve the discomfort that is accompanied with an attack of gout, and it will help you also relieve the attack as soon as possible. Then if you have recurrent attacks of gout, despite using drugs that control the level of the uric acid, then you need to see your health provider to know what is happening and whether your drugs are working appropriately, and whether you could have developed some complications that will be making your drugs not to work. And then when you are feeling weak, it is important to know that this is a condition that can be managed, and you don't need to suffer alone. So you need to know that your health provider is there for you, to work with you all the way, and be able to help you manage this condition. So what are some of the empowerment tools that you should have as your toolkit? One, you should check your water intake. Ensure you are taking 2 to 3 liters of water in a day, and this is more dependent on your weight. In one of my blogs, which is found at the Wellness Health Services website, I've written about how to calculate the amount of water that you can take in a day depending on your weight. You can check on it at the Wellness Health Services website. Then also checking your weight and making sure that you maintain your body mass index appropriately, and also looking at the food triggers that can make you to get an attack of gout, which we included like the intake of red meat, a high intake of alcohol, taking organ meat like the liver. This can and also some seafood can also trigger a bout of gout. Then have some apps that can help you track your water intake, also track your diet, and these are becoming very crucial, especially when they are connected to your electronic health records, and your health provider can be able to access these tools. And also having personalized diet calculations that will help you to calculate your calorie needs and also your nutrients needs, especially to help you lose weight. And then remember that simple habits build long-term prevention. Like we have talked about regular and daily intake of water, regular exercises, high whole grain foods. These ones can really be helpful. So take action before pain takes over. Schedule check-up today so that you know how your uric acid levels are, and share this with someone who needs it. Remember that your health is in your hands, and it is one step at a time. So healing means doing something consistently, not be perfect, because if you are looking for perfection, you may never get the